Hey friends, welcome to Yoga for Dentists. I'm your host, Dr. Josie DeVideo, longtime dentist and certified yoga teacher. Today's episode can also be found on your favorite podcast listening app by searching Yoga for Dentists. I'd like to invite you to hang out with like-minded dental professionals. We can be found hanging out on Facebook or Instagram at Yoga for Dentists. In today's episode, I chat with Dr. Nadine Kelly, a pathologist who gave herself permission to pivot and to find more joy in her life. This episode initially aired on the Josiology podcast, my other show, and I really wanted to share it with my dental friends because, especially during this time of COVID, I think many of you have reevaluated whether or not your career is actually bringing you happiness. And so I wanted to have this conversation, give you something to think about by offering this for a listen. In addition to talking career changes, we also talk about the many benefits of yoga, especially for those of us with aging bodies. Hey friends, welcome back. Today, I am chatting with Dr. Nadine Kelly, the founder of Yogi MD. Dr. Nadine, welcome to the show.
Thank you for having me, Josie. I'm so pleased to be here.
So when I first met you, I was really intrigued by your story because I am a dentist who is on sabbatical right now from my private practice. And Dr. Kelly, which I'm going to be referencing as Nadine now because we're BFFs, she is a physician. And so what kind of intrigued me about her story was that she was a physician for many years and needed a break from the daily grind of that profession. So Nadine, can you tell us a little bit about your story? What kind of physician were you? How long did you practice? And what did that look like in your life?
I was a practicing pathologist for several years, about 7 years. The path to get there was longer. So for those of your listeners who don't know, to become a pathologist, when I did, it took 4 years of college, followed by 4 years of medical school. Then at the time I was training to go into pathology, it was a 5-year residency. I decided to specialize in a category called cytopathology. So that was a specialty training for a year, and then practice for 7 years in a busy community setting. In the community, I was a generalist. So it was all aspects of pathology. A pathologist's main tool of diagnosis, I like to compare it to a radiologist. A radiologist uses film. We use a microscope. It's the same idea. The radiologist is diagnosing issues based on what he or she sees on an X-ray, and a pathologist diagnoses something he or she sees on a slide. We also covered, looking at blood work, doing specific biopsies because I was a cytopathologist, so I could do hands-on biopsies if need be for superficial things. But at any rate, the picture I'm trying to paint was a sort of a broad category of diagnosing whether something was wrong or whether something was okay. So benign versus malignant and anything in between is what I did.
So basically what you're doing is looking at things from a cellular level.
Yes.
So for example, a patient can walk in and they might look totally fine, but whatever cells you're looking at might paint a different story for that patient, that something's either wrong or, not exactly how it should be based on what you see on a slide because you're looking at people's cells.
Exactly. In different ways. Mm-hmm.
Now, what led you to that? Because that's a very specific kind of medicine.
So it was not very popular either when I made the decision, right? I generally have to explain what a pathologist does. And the reason I chose pathology is because in medical school at the time, there are several rotations to help you decide what field to choose. And so as I was going through those different rotations, nothing was quite feeling right, except for OB-GYN. I did like OB-GYN. I liked the aspect of seeing new life come into the world, but I didn't like their lifestyle. I have an uncle who's a gynecologist and obstetrician, and he's just working all the time. And he's a man, quite frankly. So did he have to worry about how was he going to bring a family into the world? No.
Correct.
So that was a very major concern for me. And so I remember we had a class in medical school. So this was just a little bit before I did all those rotations about taking physical exams and how to do the history. And believe it or not, it was a pathologist who walked in to teach that part of the course. And so we got to talking, and I was asking her questions about what she does. And so she invited me to come take a look at what a pathologist does on a daily basis in her department. And I did. And I thought, oh, this is it. I will be able to strike a work-life balance, and I will be able to do something that makes sense to my style of how I am, how I'm comfortable being in the world. Meaning, I've never been one who likes to be rushed. I've never liked feeling just scattered or like everything's an emergency or quick, make a decision. So what I liked about pathology was putting everything together. You get the information about the patient, the history, what the doctor who's taking care of that patient is seeing, because you're you're at the end. You're not an intermediary. You're at the end of the diagnostic process. Say an internal medicine person wants a diagnosis for his or her patient, or a better example would be a dermatologist. You go to see your dermatologist, you have a skin lesion. The dermatologist has an idea of what it may be, but they really need that microscopic evidence. So they send us the skin biopsy. So you get to put together all of this information from the patient's perspective, from their doctor's perspective, and what you see. I'm a hands-on person, so I liked that physical aspect. And I admired the pathologists in the department where I trained because everyone was so thoughtful and there was collaboration. If you thought you were stumped on a case, you could go talk to other people. Or if you thought something was fascinating, you could collaborate with your colleagues, and they had families. The women that I admired who were pathologists had families. They were managing being really super professional and smart doctors with being terrific moms. I mean, we got together for parties and things, and they brought their kids. And so I could see that it was possible to have all those things.
Right.
So that's why I went into pathology.
Yeah. And that makes perfect sense. And I think that's, something that's unpopular to talk about these days because we're women and we're supposed to be like equal and we're supposed to have, all things open to us. And yes, we can have access to everything we want to do, but how that looks in our lives as women is going to be different than it looks for men. And, as much as we try to fight that, the reality is that the, responsibility of child rearing and raising a family typically falls on female professionals as opposed to male counterparts. Now, I do know of a handful of situations where those roles are switched and the dad has taken on the child rearing, the bulk of the responsibility and, because of a lifestyle that they've agreed to with their partner. But I think generally speaking, culturally, we still have to be aware of that. And so I think it was wise of you to look at that because I know a lot of people go into a profession and put in a lot of work and years studying something and then have to make it look different to fit their family. And that's fine. That's fine if that's what you want to do. I think for me, the message is culturally, the messaging is one thing, like you can do it exactly the same way as the men do it, but the reality isn't necessarily that. And there are only a handful of people who can pull that off. I personally was not one of them. It sounds like you made the choice to not be one of them. Mm-hmm. I always rearranged my career to suit my family life and it worked out fine. I had a very wonderful career for 22 years. But, as a healthcare provider and a leader in my community, I would get that question a lot. Like, how do you do it? How do you pull off having a family and a practice and, be involved in all the things you're involved with? Well, something has to give. You can't have it all at the same level that you want to have it all the time. So I think that's an important conversation for us to have for any younger women or even women our age who are listening to this struggling with that. It's okay to decide that things need to look different for you in your career. You have to live your life for you, not for what other people expect of you.
That's a very good point. That's a really good point. To your last point, it is so important that you realize that you have choices to make. And even if you're not exactly clear on having a roadmap on exactly what your life is supposed to look like detail by detail, it's important to be honest with yourself as to what your values and beliefs and responsibilities, your core values and your core beliefs are, and to live your life from there. Because early on, I knew that being a professional, being educated, and also being a family person with a husband and children were very, very important to me. So I was going to have to make that work.
So at some point, you decided to pivot out of your medical practice. Talk me through what that was like.
That was a very painful process. I have to say. It was not an easy decision by any means. I have stories from family members who tell me that I always wanted to be a doctor when I was a kid, a 5-year-old. They said I was playing with my dolls and I was playing like I was their doctor and I was in a hospital. So that was always my desire. And I worked very, very hard for it. And I really thought that it was what I wanted and that I would retire in old age after practicing many, many, many years. Like those women I told you that I really admired, those pathologists who were 60s, 70s, who were at the tail end of the practice and were very proud of the work that they had done. They had made this wonderful contribution to healthcare and to their patients and to their colleagues. But that's not what happened for me. The thing is, because, well, a little bit of my background too is I'm first generation. My parents are Haitian. And so I was the firstborn here for my parents. And the idea was education for opportunity. Education is very, very important. And I completely agree with that. I believe in that. I teach my children that way. However, what was missing for me was the emotional piece, or being more in tune with how I was feeling through the process and having that be important. And that's separate from knowing what your core values and your core beliefs are. It's also being okay with, is this going well? And is this right for me? I was ignoring a lot of signals along the way because my husband was in the military and we would have many conversations like this. His training in the military felt a lot like what I was experiencing as I was training in medicine. Very hierarchical. And you always had to prove your worth, and you couldn't challenge the authority of those people who were more senior than you. And so my understanding was that life was supposed to be painful, that acquiring this education and to become a physician was not easy. It's not something that maybe everyone could do or wanted to do. So it was supposed to be hard, but more importantly, it was supposed to be painful. I also thought that it was this cyclical nature of it was normal as well. So for instance, college was very hard for me. I worked so hard. I studied. When people talk about partying in college, I have no idea what they're talking about. I did not have fun in college.
Yeah.
I just did not. I was there to study. I was there to get a job done, and I did. Okay. Then I thought, okay, now I'm in medical school. Okay, it's supposed to be difficult, but then it'll get better as time goes by. So then you keep going through these little stages, even within that dimension of medical school. Even when you started a rotation in, say, surgery, it was just a whole new world, and you had to learn all these rules and who's the boss and what you're supposed to do. Then you get to residency. I'm thinking, okay, I've got medical school behind me. I've proven that I'm okay to be here. And residency, same kind of thing. It's still like, okay, I'm at the bottom again and I have to prove myself, and it hurts. Then my fellowship, then it was time to practice. When I started practice, I was younger than everyone else. And so again, I'm faced with colleagues who are eons ahead of me in terms of experience and knowledge. And I have to prove that I deserve to be here because they chose me to be here. I have to prove my worthiness. Well, after a while, that feeling of, did I make the right decision that I was trying to bury was starting to catch up with me physically, mentally, emotionally, but also the face of medicine was changing. It was becoming more of a business. When I first was training and when I was first practicing, again, what I said to you when we began, that diagnostic, that investigative feel, that taking your time. Yes, there were emergencies, but not all the time. That idea started to shift. And in my practice, it shifted this way. We started by slimming down the number of people in the department by getting rid of transcription. So now you'd have somebody who would be typing reports for you, and then all you had to do is proofread it. No, then it turned to voice recognition. So you were dictating your own reports, checking typos, doing billing, all of that. Then we started to layer on, how about we try doing biopsies the same day? See, people think on the patient side, if you're a patient, you think that sounds great. And I can understand if you're a patient, you're anxious, you want your results the same day. But there's a person on the other end of that slide reading. And listen, I'm not saying that it's not possible to do that, but I'm just saying that remember that there is a physical person who's on the other side cranking out that same day biopsy. Then it turned into, we started a subset of biopsies same day. Then it became, let's do more. Plus, we were a multi-hospital and multi-clinic practice. So there was an aspect of running around too. Now I'm becoming more and more miserable. I remember one day I woke up and I looked at myself in the mirror and I said, as I mentioned, my parents were immigrants. They both worked in factories when they got here. I said, wow, full circle. I'm a factory worker, but I'm high paid.
Interesting.
I was not proud of myself. I was not happy. And it turns out I was fighting clinical depression for years. So that was the turning point.
Yeah, because I think, again, our messaging is always like, you can do this, you have to hustle, like you said, you got to prove yourself. And for some people, I mean, I hate to do blanket statements. I'm going to get a bunch of emails about this, but I mean, the reality is we do suppress a lot of unpleasant emotion or feelings. We ignore it because we have a job to do. We have studied a long time to do this job. For me, I was ignoring a lot of physical issues. So, fine, I feel lousy, I feel terrible, but I still got to go to work.
Mm-hmm.
I still have the responsibility of taking care of my patients who I really cared about, and I didn't want to let them down, and I didn't want to let down my colleagues who, I've trained with and who I'm in this community with. But the bottom line is, ultimately, I was letting myself down. I was letting myself down physically by ignoring what was going on with me, letting myself down mentally by not just having a realistic conversation of like, you need a break. You can't continue at this level.
Mm-hmm.
Similar to your field, things are changing in the field of dentistry, and it's hard to keep up with. I mean, it's probably easier to keep up with if you also don't have a family to deal with at home and responsibilities at home, right? So maybe, I know a lot of my male colleagues didn't struggle as much as I found myself struggling towards the time where I was starting to think like, I really do need to take a break here and reevaluate some things, because as much as I loved dentistry, I don't love it more than I love my own well-being and health.
Mm-hmm. Mm-hmm. I hear you.
Yeah. And the bottom line is we have to ultimately give ourselves the permission to listen to ourselves and not worry about what the other people are expecting of us or what they're going to think. I think what happens is we start to worry that it's perceived as a weakness of like, we can't handle it or we are making a bad decision. But what I've learned in the several months that I've been off now dealing with my health is that it's really the ultimate strength, because you make a decision in the face of adversity that is counterintuitive to what everyone else expects of you. And you make that decision for your own well-being. And there is no stronger act for yourself than to make that decision.
I completely agree.
All right. So Nadine, you got to the point in your medical career where it just wasn't serving you anymore. On different levels, you realized that you had that voice that you were suppressing that was telling you what you needed to hear, but you weren't ready to hear it. So what was the defining moment that made you say, okay, this is enough. I gotta change and do something else now?
The defining moment was the last day that I practiced. I was so dissociated I was experiencing disassociation and disconnecting from my body. People who have been depressed would be able to understand this. You just feel like you can't totally be in your body anymore because it hurts so badly. And so you almost feel like you have to float above it or out of it. I don't know how else to explain that any better, but I remember it's like a trance sort of. And I remember I was walking to the door to go to my car, into the garage essentially. And my husband, who is not the most emotional man in the world, he's not, okay? So just to paint a picture, for him to notice something was really wrong was bad.
Yeah.
So I'll never forget it. It was a morning and I was walking to the door and I feel his hand on my shoulder and he turns me around and he's really concerned. And he goes, "Are you going to be okay?" And I looked at him and I said, "I have no choice. I'll get through it." Right before I walked out, he said, "I'm going to need for you to talk to your doctor today. You have to promise me you do that." And so I did. I had to keep my promise. And I went to see my doctor that evening. Well, that's unheard of, right?
Yeah.
They get you in right away like that. So I got in that evening and I spent 2 hours in my internal medicine physician's office crying. So It was time to make a change.
Yeah.
It was a life or death situation at that point. I had no idea what I was going to do. I had been practicing things for myself to maintain my sanity and my physical strength and endurance, namely Taekwondo. I'm a black belt.
Wow.
I was doing that. And I was doing that. It was, again, for physical, but it was also really, I loved the mind body connection aspect of it. It wasn't just going to exercise like cardio where you're not, and I'm not saying that you can't, but for me, getting on a treadmill or something, I wasn't engaging my brain with it. I didn't feel challenged and I needed to feel that connection. So Taekwondo did that for me. And it was something that I was able to practice with my girls. And then I was also practicing yoga because I had taken my mom to her first yoga class after she survived cancer, breast cancer. So I was doing those two things. And after I stopped practicing medicine, I wasn't sure what to do. So I walked into a local yoga studio one evening and I explained to them that I think I'd like to deepen my yoga practice just so I can have space and time now to figure out what's next for me. Well, the owner of the studio said, we're having a teacher training program right now. Why don't you join? And I laughed and I said, what do you mean yoga teacher training? What are you talking about? So he said, no, look, you don't have to teach anything, but you can learn more about yoga and more about yourself that way. It's just a great journey to take. Halfway through training, a lovely, mature woman, again, these pillars, women that I always think of in my life. I can think of many of them in various parts of my journey who just have that something about them, that calmness, that wisdom, that confidence. Walked in and she taught a yoga class unlike anything I had been exposed to. It was very slow. It was very, on the surface, very simple. It didn't involve a lot of flowing or fast or difficult movements. It was one of the most difficult practices I did, and yet one of the most magical practices. And a light bulb went off. And I thought, this is what I want to do. I can be proud of myself. One of my core values I'll come back to is I learned my integrity, my sense of purpose, and being proud of myself. I wanted to be able to wake up and look at myself in the morning and be proud of the work that I was doing, connected to it. And I saw this opportunity to use my medical training for a specific group of people. I wanted to work with older people, older women specifically, to help them maintain their overall health through yoga. I could use my pathology persona to break apart little details and make things make a little bit more sense, dissect different poses so that, say, a person in a wheelchair could do a warrior two, a person on the floor standing could do a warrior, someone sitting could do a warrior two. So that really just got me excited. And I felt like I could apply all of those things. And it was very important to me to serve. That's why I became a doctor. It was that cliche, I wanted to help people. That was true for me. So I wanted to feel like I was really making a positive impact in people's lives. And so I found that through Yogi MD.
That's awesome. There are a lot of misconceptions when it comes to yoga. Can we talk about a few of those?
Absolutely, because I hear them all the time. Okay. Yoga is for the young, the thin, the flexible. I can't do yoga because I'm not flexible. That doesn't make any sense. It's like if you walk into somebody's kitchen, you've never tried preparing a meal and you said, but I can't do this because I've never cooked before. Right. Because you have to learn how to do it. And then it's a skill and you develop it. You can't just walk in and say, I'm a chef. Okay. So same idea. You don't have to be flexible to practice. You don't have to even get on the floor to practice. You don't have to be thin. Let me put it this way. You don't have to force yourself into poses. You can make the poses work for you and adjust the way you can. For instance, I have women in my classes who've had hip replacements or knee replacements. They're not supposed to move that lower body like someone else who hasn't had those issues should. So does that mean that she can't do that pose? She can't do that pose the way it looks in a magazine, but she can honor that pose in a different way. She can do it with modifications, or she can do it in a pool. I've had a lot of people find freedom in the pool to do things because that's a buoyant, supportive medium versus land. And so maybe that warrior two in the chair or by the wall was more difficult or not accessible for that particular person because of her anatomy or whatever it is. But then when you take her into the pool, oh my goodness, I can do a warrior two at the pool wall, holding onto the pool ledge, holding onto this whatever. Okay. So you can tell I'm getting very excited because there are
That's
just
great.
many modifications that you can make. So, and yoga is not that superficial, competitive, Instagram worthy pose on a mountaintop. You're not getting the point of yoga when you practice it in a competitive way like that. The point of yoga is to learn more about yourself. The poses help keep your body strong and develop flexibility and all that. But it's really this gateway into connecting deeper into your mental space, your emotions, becoming more self-compassionate, becoming more self-aware. When you do all these physical practices and you relax, then you can allow yourself to have a guided relaxation at the end of the practice. Then you're ready for a meditation, which is what people think of. This is the next myth. It's a religion. No, it is not. It's a spiritual practice, yes, but it is simply, there are multiple ways to meditate. What we're trying to do when we meditate, you can pray to meditate. You can sit quietly to meditate. You can focus on your breath. But the idea is you're paying attention to your thoughts. We all have these repetitive thoughts. We all have these stories we're telling ourselves. Until you give yourself time and space to pay attention to your patterns of thinking, it's very hard to grow. It is very hard to challenge. I've been telling myself this myth all this time, but is it true? Am I limiting my potential by the limiting story that I'm telling myself? And in a lot of cases, I particularly have found that to be true for myself. For women, you touched upon this a little while ago. We as women tell each other the should and the have to all the time. But how about challenging that? That comes with quiet. That comes with more self-awareness, self-compassion to say, is that should statement I'm making to myself really true? Who has to live with the consequences? Only I do. So the should, if I had continued pursuing medicine, practicing, I would not be here right now, period.
Mm-hmm.
Okay. And I had to come to that realization that it was okay not to should on myself anymore and say, just because it makes everyone else around me, society, comfortable, that I can walk around and say, I'm a doctor. And also to kind of bolster some self-esteem for myself too, to be able to say I'm a doctor, doesn't mean that I have to keep satisfying everyone else's expectations. It's no longer working. It's my business. I'm the one who has to accept the consequences of getting up every day and going to do this job. No one else does. So however anyone else wants to judge me, and there were people who were naysayers, I had to leave that behind and do what was best for me.
Absolutely.
And all of that comes from yoga. It does. It's been a very influential practice in my life, both for myself and for the people that I help.
Now, the people that you help seem to be predominantly women over age 50.
Yes.
Is there a reason you focused your passion on that age?
It happened organically. As I said, when I think about all of the matriarchs in my life, it was kind of on a subliminal level, right? Or subconscious level that I was looking to these women for advice and encouragement. And when I started my yoga journey, I did try a lot of things. I trained to teach kids. I tried yoga studios. I did. I wanted to dabble and figure out what was right for me. But eventually, I just didn't want to fight anymore, force anything. And it became organic. Older women were speaking to me, and my style of teaching was connecting with them. And so it just happened that way as well. But I don't think it was an accident. It's just who I relate to very, very well.
And what are the benefits for this population? Because as you said, a lot of people think that yoga is like a young person's sport, so to speak, right?
Mm-hmm.
As we age, I mean, everybody can benefit from yoga, but specifically as we're aging, what are the benefits?
There are so many. So I span this line between East and West, right? There's so many proven studies at this point. As we're aging, because we're here longer, maybe because of diet, maybe because of lifestyle, we are more prone to certain chronic diseases. We have common chronic diseases such as hypertension, diabetes, osteoarthritis. So those are just a few common chronic diseases we deal with. A gentle yoga practice mitigates the effects, the symptoms of those chronic diseases, and sometimes can even help delay even developing those diseases. We derive better sleep through yoga practice. I've had ladies come in, as I mentioned, with the hip and knee replacements both before and after. I've had the same person pre-surgery have the surgery and come in post for rehabilitation reasons. That subset of people have told me that they felt like part of their ability to recover from surgery, they can thank because of their yoga practice, because it gave them the strength. I've had people who have a lot of osteoarthritis and can't do anything else because it's too painful, like walking, say. That's a gentle form, right? But if you have really severe osteoarthritis in your hip, it may be hard to walk for even a few minutes, okay? Before your hip starts to ache. So what if you go to an aqua class? And there are different options, right? I'm not talking about aqua size, which is also important. But if you come to my yoga class and it's slower and all that, you can still receive the benefits of strengthening your muscles, strengthening your bones. I forgot to mention osteoporosis does also help with regular yoga practice. That's very much proven. Yoga strengthens your bones. I could really go on and on and on, but there are many physical benefits to practicing yoga, in addition to the more mental, emotional states, such as stress reduction, relaxation. We take those things for granted and we just kind of toss it in the air like, oh, it relieves stress. No. It really does help you to relieve stress, calming your parasympathetic nervous system by even teaching you how to breathe. And even more so, knowing when you need, as you cultivate this increased sense of self-awareness, you'll begin to know when you need to reach into your toolbox that you've developed with yoga. 2 examples, 2 ladies I can think of, because I teach cancer survivors as well. 2 of them wrote me testimonials and said, I had to go do a follow-up MRI today, or I was sitting in the doctor's office waiting for the test. In both instances, they had medical tests. The anxiety, the uncertainty. So you know what they did? 2 different people told me. I started to do my yoga breathing, Nadine. I thought about what you were saying and I just started to relax. And I just started to do my yoga breathing and I calmed myself down. The one lady in an MRI machine, even though she was claustrophobic, and the other lady in the waiting room waiting for her results.
And that's got to feel good to know that you've impacted their life in that way.
And that's another reason why I do this, because I'm a fair, practical gal. And I don't want this to just be, as people like to say, woo-woo, or you just come to class and you just go through the motions in the class. And when you leave the door, it's like, oh, off to do something else. No, I want my students, my ladies, to go out and use what they've learned, whatever's relevant to them in their lives.
Now, it sounds like in your life, you have really been mentored by, let's say, older, wiser women in your life. And so now that you find yourself teaching older women, and it sounds like a handful of what we would call seniors, right? What have you learned from them?
Oh, gosh, that's a wonderful question. So many things. Sometimes I even feel a little selfish and indulgent because I feel like, who's really gaining here when I leave? Because I'm so happy when I'm teaching my classes, when I'm amongst these women, because they give so much to me. They give me the gift of their laughter. They give me the gift of their wisdom, their life experiences, their stories. I love to hear their stories. I've never been one of those people who, I guess this is kind of a sign, right? I was always that person who stayed seated, like say at a party setting, and one of my elders would be telling a story and everyone was kind of sick of hearing it and would get up and leave. I always stayed because I wanted to hear it. So I love the stories. I love and it's not perfect, but it's definitely more so in that age group than younger, the self-assurance and the deeper sense of gratitude for life and its moments and recognizing special moments, the desire to slow down. Yeah, I could just go on and on. It's just a really, really rich experience for me. I'm very lucky.
Now, from your unique perspective as a physician, how do you define being healthy?
The reason why I started my own podcast is because, as I mentioned, my yoga classes are not your traditional yoga class. I offer them in different mediums, but I also merge everything that I've learned. I'm always going to be trying to bring in evidence. So, like, for instance, 2 weeks ago, I read an article that talked about the advantages of resistance training to help with type 2 diabetes. I got real excited. I made copies for my class. I took the copies to class. We discussed it in the beginning, and then I fashioned the practice to make sense. So we did a little bit of resistance in our yoga practice to tie all those concepts together. So I'm always going to love to be able to use evidence-based material as well. The point of the podcast is because I do love to educate so well. You don't have time to sit and do like an hour talk about osteoporosis or whatever in class, right? So I thought, okay, this is a platform where I could do that, but I could also expand our definition as women of what it means to be healthy. What our society's messaging is telling us is that it's just about your dress size and the latest diet. And we all know people who are just concerned. Josie, tell me the last time you went to a party with a bunch of women and somebody didn't start talking about what was on her plate right away.
Right.
So it's just like, can we get past the same superficial discussions? You're more than your appearance. I'm not saying that you shouldn't try to be your healthiest. It's very important to take care of your body, but you're more than that. I was a pathologist. I saw a lot of bad outcomes on a regular basis. A lot of good, but a lot of bad. Tomorrow, from a very, again, experienced perspective, tomorrow is not guaranteed to anyone.
Right.
So are we going to squander our lives as women just thinking on this level, dress size and food? No. So health is about that, but it's also about your social health. Who do you surround yourself with? What are you doing every day to find your purpose? Even after retiring, I've had people come in, post-retirees too. I don't know what to do with myself anymore. My job was my identity. So finding other social outlets to have a purpose is part of your health. You're taking care of your intellectual well-being. That's another aspect of your health. We should always be trying to learn new things. People are worried about dementia. Keep learning new things. It helps. And then your spiritual well-being is very personal, but it's just however you decide, whether it's universe, whether it's God, whatever that is for you. What are you a part of? What are you a small part of? There's something out there that's bigger than you. And just honoring that. So being healthy is not just your physical, it's also your mental, your emotional, your social, your spiritual, and your intellectual well-being. It's all of those things. They're connected. I'll give you a very good example from my perspective in what we've been talking about. I was taking care of my body physically when I was in residency and all that. I was exercising a lot, okay, because it was a stress reliever for me. But I wasn't taking care of my mental, emotional body. And the physical started to deteriorate to catch up with me. I was getting headaches. I had to switch my glasses. I was getting just a lot of different body aches. My sense of purpose was slipping. So that started to affect how I felt about myself and my emotions. So even though we want to pretend we can compartmentalize things, all of these things are connected.
Absolutely. And your podcast is called Yogi MD.
Yes, the Yogi MD podcast.
Yogi MD podcast, and it's available on all platforms. So if you're listening to this and you want to learn more about what Nadine is teaching on her podcast, you should check that out. Now, knowing what you know now, Nadine, if you had to go back and tell your younger self something about life, what would that be?
I would tell her to be nicer to herself. I would ask her why she feels the need to be so hard on herself.
Interesting. Nadine, I think it's so great that you have found a way to pivot and use your extensive training to continue to inspire people to live healthier lives. That's something that I hope everyone understands from hearing your story today, that everything we learn in life is useful, even if we decide to use our knowledge in a different way than is expected of us, or even than what we thought we were going to be doing with it. We are allowed to change. We're allowed to grow, to evolve, and to do whatever it is that brings new meaning and purpose in our lives, especially in a way that allows us to serve others. So Nadine, good on you for listening to your soul and standing in your purpose.
Thank you, Chelsea.
If you would like to learn more about Nadine Kelly, please see her website, yogimd.net, or you can follow her on Facebook and Instagram at yogimdnet. And of course, check out her excellent podcast, Yogi MD Podcast, available on all platforms.